Coming of Age is coming up next. I'm your host, Josh Newby. Remaining safe and independent in your own home is a primary goal of our agency, but we wouldn't be able to empower elder adults to do so without help from organizations in the community. Organizations such as Home Instead Senior Care. We break down the different options available to vulnerable adults in our community with them. But first, Baptist Healthcare has an exciting new tool that modernizes the primary care appointment process. Stay tuned. Coming of Age starts right now. As we age, staying active in life and involved in the community can become a challenge. But with Council on Aging of West Florida's range of home-based services, you remain healthy, independent, and engaged. From Meals on Wheels and respite care to senior dining sites and the retreat, you'll feel empowered to regain your freedom while retaining what makes you, you. We've been in the community for nearly 50 years, advocating for elders and supporting those who care for our parents and grandparents. We were there when your father's health began declining, when your mother needed companionship during the day. And guess what? We'll be there down the road when you need those services too. Now, join with us as we talk together about the aging issues that matter to you. An important goal of Baptist Healthcare is to improve and enhance the ability of the Northwest Florida community to access the health care they need when they need it. To help do that, Baptist offers Easy Schedule, a simple-to-use way to make an appointment online with a Baptist primary care or specialty care clinic. Sarah Brown, Consumer Access Specialist with Baptist Healthcare, is here today to demonstrate how to use Easy Schedule. Sarah, thank you so much for coming on today.
Thank you for having me.
To get started, what is Easy Schedule?
So Easy Schedule is a great new tool for anyone in the community to be able to use to go online and book their primary care or specialty care appointment. We have all of our primary care providers available online. It's very simple. You just go to easyschedule.com. You can enter a doctor's name or a location, find who you're looking for, and book an appointment, and then you can print your paperwork and show up. That's all you have to do.
Excellent. What makes Easy Schedule so easy, so convenient to use?
So it's a one-stop shop for all of our Baptist healthcare services that we do offer online. Again, you just have to go to the website and book your appointment. It's very simple. It's very easy to use. Young people, middle-aged people, elderly people can all use it.
Excellent. Do I receive any sort of notifications or reminders about the appointment through
Yes,
Easy Schedule?
absolutely. Once you book your appointment online, you will receive a confirmation notice via email or text messages. You can sign up for text message reminders, and it will the system will remind you of your appointment as it gets closer to time, so you don't forget.
Does it cost anything extra to use it?
No, it does not cost anything. It's completely free, a service offered by Baptist Healthcare.
Now, what if, because I've used online portals to sign up for things before, and what if my provider is not listed on there? Is there help available online? Do I call? What do I do if I don't see an option available online?
That's a great question. If you do not see the provider that you're looking for, you can call our Baptist consumer line, which is 434-4080. That is the number, and they will help you connect to the clinic or the provider that you're looking for.
And what if I have to cancel my appointment?
You can either cancel it online through Easy Schedule, or you can call the 4080 line and have them cancel it for you, or you can call directly to the clinic and let them know, and they can cancel the appointment for you.
Okay, so I can register for the appointment and also cancel the appointment.
Correct.
All online if need
Yes.
be. Okay. It sounds great. It sounds extremely convenient, but just like with anything online, the first time you do that, there might be some hurdles.
Absolutely.
So you're going to walk us through
Yes.
the process today. So let's get a brief walkthrough of how to use Easy Schedule.
Okay. So first, you just have to go to easyschedule.com. That is how you access the tool. Once you go online, then you can begin your search.
Okay.
So after going online, you need to either search for your provider or you need to search by location. Once you have done so, you will select the time. You'll see all of the availability listed. You select a time, enter some demographic information, and then confirm your appointment. So first, you will go into easyschedule.com. It'll pop up to this screen right here. You can either select a provider type. So if you're looking for a family physician, if you need a new primary care doctor, if you have some more complicated illnesses and need an internal medicine provider, pediatrician. We also offer gastroenterology and other specialties that you can direct book right to their clinics. So you can pick a type of doctor, and then you can enter your location. Okay. This does have some intuition, so it will ask you if you want to share your location, like many online tools, and so you can say yes, and it'll just auto-populate where you are, and then you hit find and book, and it will give you a list of all of the doctors available based on your search criteria. If you know who you want to book with, so say you see one of our providers already, you can click the search by name button and then enter the provider's name and click find and book, and it will display all of the results for that specific provider.
Sure.
So once you've entered your search criteria and you've hit find and booked, the next step is to select an available time. When your search results display, it is very clear what is available. So you have the dates and the days and dates at the top. You can advance if you don't want to be seen this week. It'll give you the soonest availability. So if you want to book it out a couple of weeks or whatever the case may be, you can advance to the next additional appointments. You can hover over what's available to see what type of appointment, whether it's a new patient or if you're already established with the practice and you just need to follow up. It will guide you to where you want to, or to what type of appointment you want to select. Okay. You find your time, you enter, you click on the appointment, and then you enter your contact information. So once you've entered your contact information, this information is used to remind you of your appointment, send you text message reminders, and to confirm your appointment. Confirming your appointment becomes very critical in the process as you finish your demographics. Sure. You'll enter your patient details. Most of this information is going to auto-populate if you've been on Easy Schedule before. Okay. If you haven't, you just quickly fill out your information. It's not a lot, but what is important is you complete the symptoms field to let the clinic know why you're coming in for the appointment so that they can prepare and make sure that they have everything that you need when you arrive.
Right.
Appointment reminders, this is a great tool because it does allow you to get text message reminders, so you can opt in or out, and then you just populate your information. You can check the use my contact number, so you don't have to refill that information out, so it's very efficient for the consumer to book their appointment. Confirming your appointment is very crucial in the process. You have to confirm it in order for the practice to know that you really do want the appointment. Okay. The confirmation process is very simple. You let the system know, do you want an email notification or do you want a phone call? Either way, it's going to say just press 1 to confirm or click here to confirm. Once that appointment is confirmed, it automatically sends the notification to the office so that they know that you're coming. Okay. And you will also get an email communication on how to prepare for your visit. So there is a note from the provider that you would want to read. There's a link at the bottom of that note to access new patient paperwork if you're a new patient. So that way you don't have to come in early and fill it out in the clinic.
Oh, you can fill it out ahead of time.
You can go ahead and print it out, fill it out, and bring it in with you. It tells you how to prepare for your appointment or any information that you might need to make sure that you have the right match with the right provider.
Okay, excellent.
And that's all you have to do. And you can visit easyschedule.com, or again, you can call the 4080 consumer line if you have any questions, and they can help direct you to the appointment that you need.
Well, it's very easy.
Very
easy schedule. I'm just curious, how long has that been active?
So it's been active for almost 2 years now.
Oh, really? Okay.
We've been building our providers into the system. So you see all of our primary care is available. We're building our specialty network, and you will continue to see more and more specialists come on board, and you'll be able to direct book right to their schedule without having to call and wait on hold or get kind of lost in the phone shuffle of clinics. Sometimes that can be a little bit difficult. You can also go online 24/7. Right. It's accessible, so 9 o'clock at night, if you remember, I need to make an appointment, you can jump on Easy Schedule, make your appointment. It's very efficient.
And just to remind people, if they don't see their provider on Easy Schedule, what do they do?
They call the 4080 line, 434-4080, and they will direct them to the clinic that they want to try to get an appointment with.
Excellent. Well,
Yep.
it's a great tool, very convenient for
Yep.
our elders. Thank you for coming on today.
Thank you.
Next, we'll talk about exciting changes in the local in-home services industry with Home Instead Senior Care.
Why do people love ACT's retirement life communities? There are more reasons than just the active lifestyle. Like ACT's Life Care, a plan that protects your nest egg with predictable monthly fees, even if your healthcare needs increase. So you can enjoy a carefree today and a worry-free tomorrow. Plan a visit and see why our satisfaction rating with current residents stands at 98%. ACT's Retirement Life Communities, where loving kindness lives.
What does it look like when a life is truly changed?
I feel a sense of accomplishment because I built a house. This house has brought us financial independence.
It's a great place to raise a family.
Strength, fuerza. When I look back where we've come from to where we are today, it makes my heart very happy.
Potential.
Potencia.
For me, this house means all of us together.
Sorry.
Security.
Security.
Every family dreams to have their own house. This house changed our lives.
Habitat for Humanity is at work in your community and around the world. Through shelter, we empower.
I enjoy helping my clients because I get a lot of satisfaction at the end of the day. If I know that I've done my best to get my clients the benefits they're entitled to, whether it's workers' compensation, Social Security disability, or car accidents. Any of those three areas of law provide a means for me to help people that don't have a means of helping themselves. My name is Brett Bogodsky. I'm an attorney with Levin Papantonio.
Hart, what's going on? I'm leaving. Why? What did I do? Not enough. You constantly ignore me. You barely eat anything healthy. You're half as active as you used to be. The pressure is just too much. I quit. Okay, I get it. I'll do better. Just please, don't leave. Okay. But remember, if I go, you go.
Listen to your heart. Don't let it quit on you. Uncontrolled high blood pressure could lead to stroke, heart attack, or death. Get yours to a healthy range before it's too late.
When cancer tries to take you away from the things that matter most, Baptist Cancer Institute offers caring physicians and the most innovative treatment options. With convenient locations and a wide array of support programs and services, we're here to help you during the most difficult of times. As a member of the Mayo Clinic Care Network, we're bringing even more innovative cancer care to our community right here at home. When you need cancer care, we'll be there.
In-home services provide indispensable help to you or your loved one as they age. From home cleaning and meal preparation to bathing and transportation, companies like Home Instead Senior Care help ensure you can live safely at home with dignity for as long as possible. They help with the activities of daily living you may have taken for granted up until now. Let's learn more about this topic with Stacy Rebello of Home Instead Senior Care. Stacy, thank you for coming back to the show.
Thank you so much for having me. It's always a pleasure.
Absolutely. So for those who don't know, what is Home Instead Senior Care? What do you guys do?
Well, what we do is we employ caregivers, home health aides, and CNAs that provide care for seniors wherever they call home. So anything from their light housekeeping, the doctor's appointments, even just meal preparation, but sometimes I might get more advanced services like personal care, so it'd be bathing, grooming, and continence issues. And we also specialize in Alzheimer's and dementia care.
So tell me a little bit more about the services you provide and also how you select what services are right for what client.
Well, really there is a process. It's an intake process that we have, and it's actually pretty unique to Home Instead. It's something we've been doing for about a year now. The intake service, what we do is we go out to the home after someone's called for services at our office. It says they need care. We go out and do a home consultation. It is free, no obligation, but we can go out, talk with the family or the actual client, And we actually do an evaluation on what they need. And what I mean by that is we actually have a care calculator assessment. So what that does is it breaks down the 8 care needs. And so our 8 care needs at Home Instead is basically what Home Instead is. So it can be anything from their gait, their eating, their medications. It's exactly what we train our caregivers on. So it's common language in Home Instead. So what we do is we do this assessment, and then it calculates how much care that they need in the home.
Okay.
So, you know, for example, someone might need 40 hours a week based on this assessment. So what it's doing is it's creating a care plan. It's basically prescribing care for somebody.
Okay.
So we take that back and we put it into our system, and the caregivers, whenever they go out to the home, they actually have an app on their phone, and they click on the app, GPS activated, so we know that they've entered it to the home and that they are there. They're clocking in, and when they clock in, the task they release is actually the care plan that has been created in the home from the 8 care needs. And the caregivers know what the 8 care needs because that's what their training is based on.
Sure.
So we, like I said, we have that common language. So it all kind of goes hand in hand. And what's great about this program is that the families, they can go into it as well, and there's a family room, and they can see exactly what caregiver goes into the home. They can see the tasks that are released and that are actually being documented. And then we can also provide billing that way as well.
Okay. To build on that, I imagine some family members, and I've dealt with this in my own family as well, they're a little apprehensive, right, about welcoming a quote-unquote stranger into the home. Is this individual competent? Are they safe?
Yes.
Tell us about that screening and training process.
Well, all of our caregivers, they go through level 2 background checks, and you know that is recommended by ACA, who is the governing body of home health services here in Florida. And but then we also do the driver's license check, the drug screening. We do random drug screening. We also have a pretty involved education program. So not only do we do just basic caregiving needs, but once they've graduated from our training course, they are a home health aide.
Okay.
And they can take that with them.
Right.
So we really, you know, for me as a business owner, something that I'm very passionate about is making sure that all of our caregivers, they have the right training, and of course that they're educated.
Right.
I think what's unique about Home Instead too is that our Alzheimer's training program, that is endorsed by the Alzheimer's Association.
Okay.
And of course, you know, we're finding more and more people that need our services.
Sure.
They are finding that they have some sort of dementia.
Yeah. I'm curious, you know, if let's say that I determine that I might need help. I have a suspicion that I might need help for, you know, for my parents, for my grandparents. How does that start? I know you talked a little bit about the assessment process.
Right.
But how do I get started with services? How quickly can services begin?
Okay.
Speak to that.
Well, a lot of people, what they do is they call us. They can find our number online, but of course we have online tools as well. So they can go online, they can inquire online. We actually have chat that they can do, and they chat with someone live in our office. And that is available 24 hours a day. If they decided that they want to go ahead and do a service call, is what we call it, we'll come out and do the consultation. And if they want to start services, we can start as little as 24 hours.
Oh, wow.
So, and not to say that, you know, we can't start same day, but we like to do the 24 hours because our caregivers, they need to give a heads up because they have lives too.
Right.
So make sure that we can get a schedule in place.
Speak about the value, and I know at Council on Aging we're all about this, but speak about the value of keeping someone in their home. Because not everyone needs a nursing home, although some certainly do. Not everyone needs an assisted living facility, although some do. But I think a lot of people would be surprised at how independently they can live at home with just a little bit of help.
Exactly. You know, I think a lot of this goes back to some of the family members. You know, trying to make decisions for their parents is obviously very hard. But you know, making that leap of faith, knowing that someone can come in that's had the right screening, that has the right training, can keep their parents home longer, and give them peace of mind. You know, I think we're finding, this is a pretty cool statistic, but we're finding that people that are over the age of 65, their population is actually larger than people that are age of 5 and under. So we're seeing something that's never happened in human history. So people are having to make more decisions, and for that long-term care, you know, people make decisions for funerals all the time. They make decisions for babies or for their marriage. You know, these are finding that conversation between your adult children and yourself, trying to decide what you need for long-term care is essential.
Yeah.
Because we are living so much longer. And of course, living at home, home is where the heart is.
Absolutely.
And people do want to stay home longer.
Yeah.
Obviously, not like you said, not everyone can stay at home, but we can provide care wherever they call home.
Sure.
So if they're living in an ALF, that is their home, and they want to stay there until the end of life, we can provide that care for them.
That's a good point. Yeah, so it doesn't matter where they are. You can meet them essentially where they are.
Exactly.
Do you ever run into an issue where a senior needs help, right? It's obvious that they need help, but they don't necessarily want to admit that they do or receive that help because a large percentage of that population, they're very proud.
Yes.
They're very self-sufficient. What advice do you have for caregivers with that challenge?
Well, there's a couple things.
Yeah.
First, obviously, we tell the adult children, try to, see what you can do on your own by convincing your parents. There is a PR campaign that we did several years ago called the 40-70 rule.
Mm-hmm.
So if you're at least 40 and your parents are at least 70, it gives you communication tools of how to talk to your parents about how to get care started. One individual, might need, they might not need to drive anymore.
Right.
So, this is a very typical scenario, trying to take the keys away from your parents. That's such a huge independence situation.
Absolutely.
So, typically what we do is we tell them, go take them up to get their driver's license, do a driving test.
There you go.
And see what happens from there. And then, of course, get their family physician involved. Okay. If the family physician feels like they shouldn't be driving, a lot of times individuals, they will listen to their family physician.
That's interesting.
Yeah, and that seems to really work.
Okay. Yeah, that's good advice because I know for a lot of parents, switching that power dynamic where the kids are now sort of the ones in charge and might know better. I imagine that can be sort of difficult for the parents.
It is, and of course, the daughter, and that's usually what it is. We call them the Kathy. That's what we call them in home instead.
Yeah.
They're usually the ones making decisions for their parents.
Mm-hmm.
That role has changed. They are now actually like the parent, making those decisions, trying to do what's best for their parents.
Yeah.
But they really want to feel like a daughter again.
Definitely.
And they want to be able to enjoy those years with their parents.
Yeah.
And a lot of times there is that resentment that goes on.
Mm-hmm.
So, having a service like ours has been able to come in and be a mediator and, like I said, making the daughter feel like a daughter again.
Good. Well, let's switch gears a little bit. I understand that you have a brand new facility. I've been to it. It is gorgeous, beautiful. I know you're very proud of it.
Yes.
But it's really focused on the caregiver. Tell us about the new facility.
So, of course, it's our 20th year.
Right.
So we are celebrating big this year, and we decided to really just make this all about the caregivers, because the caregivers, they are the lifeblood of Home Instead.
Definitely.
They're the heart of Home Instead. They're the ones, they're the eyes and the ears of the home. Right now we have a really neat caregiver cafe.
Yeah.
So they come in, if they're in between shifts, they can come and chill out, they can grab a cup of coffee, they can even just come and hang out with some of us in the office, because they are working individually. A lot of times they're going from shifts and then just working with a client and then going to another shift and then they go home. So they're not really having a lot of adult interaction as well. So
it's important.
This is important. So having them come into the office and feeling like part of the family and part of the team is so important. And keeping them retained is a big, big deal.
Definitely.
Of course, before they get hired, we have a really nice training center for them. And so the training center, it is dedicated to what they're going to be doing in the home. We have a training coordinator specifically dedicated to them. And like I said, once they they're hired or they go through the training, they're a home health aide.
Which is awesome.
Yes, it is. And it's a career path for them.
Yeah.
There are so many people that have come to us and they're just wanting to get their feet wet into the healthcare field. This is an opportunity for them to go beyond that, whether it's going to administration or going to clinical side. They've really been able to kind of just get in and decide this is where they want to be. And of course, we've seen the other end of the spectrum where people, they have been retired and they want to come back and they want to work. They need to feel like they have purpose again. And this is a great career for them because it's flexible, but then they feel like they're still really having that connection with somebody.
Yeah. You mentioned this is your 20th year. I'm sure that the organization has gone through a lot of changes in that time, but you've kept it in the family from what I know of your origin story.
Right.
Just briefly share with us how Home Instead got started and what you've sort of changed about it over the years.
Okay. Well, So, you know, it's really interesting, but my mom, she was the owner, and she started that Home Instead franchise here in Pensacola in December of '99. And back then I was in college, and she recruited me to come and work for her. And fortunately, I'd already worked at Baptist Hospital, so I'd worked a lot with seniors, and I had seen, you know, just how, you know, when people get home, how they, you know, they do thrive and they are better. And so that experience really kind of gave me a little bit of insight of how home care really was going to be beneficial to our community. And I stayed with her for a few years, and then of course Home Instead was growing. I kind of changed careers a little bit. I was a teacher, working with children, which is sometimes kind of the same thing.
Right, in a different way, yeah.
Right. But I came back to Home Instead in '06, and we had gotten our home health license, and which is provided, we can do like the incontinence and the personal care. And from then, we've just been able to provide so much care for seniors. I think right now we figured out we've serviced, I think, close to, about 2,300 people over the past 20 years.
Oh, wow.
And we've employed about 1,700 people.
Wow.
So
that's impressive.
Pretty impressive. Yeah. We, and you know, the things that we've done over the years, just the community and, you know, being able to give back, you know, we wouldn't be able to do that if we didn't provide the services that we do. And that is something that I've been very passionate about. And things that I've learned from working with Home Instead is, you know, giving back and being involved in the community. I think it's important, you know, for people to know that there's services like us out there.
Absolutely. I know Home Instead, both the local office and the national office are big supporters of Council on Aging, and we appreciate that. We have just about a minute left, but I want to give you a chance. I know you're having a ribbon cutting coming up, so tell us about that just briefly.
Okay, so ribbon cutting is May 22nd, 2 o'clock. So we'd love to have you there. I think we're going to have actually both chambers, so Gulf Breeze and Pensacola, so that's the plan. But it's also celebrating, you know, our new facility.
Yeah.
So it's going to be kind of a little bit of both. Coming in, doing our 20th anniversary party, but at our new location.
Awesome, awesome. Thank you so much, Stacey, for coming on. Thank you for your support as well.
Thank you.
And thank you for watching. Until next time, enjoy life. You've earned it.
They'll test you. Try to break your will. But however loud the loudness gets, however many cheese puffs may fly, you're the driver, the one in control. Stand firm. Just wait. And move only when you hear the click that says they're buckled in for the drive. Never give up till they buckle up.